Okay, well, thank you. Firstly, just to echo what Peter and Tess have said, that, we're much stronger when we are together. And I think one of the most, the best thing has happened is that we've all come together to fight this enemy. And I think we're much closer together now than we ever were. So my story is really an awful story. And, my fight is just not for my patients, but for patients in this country across the world. Because basically the very essence of the patient-physician relationship has been challenged. Our Hippocratic duty to look after the patient and to do the best we want to for the patient. We're not telling doctors how to practice. What we're saying is doctors have the right to treat their patients, the way they seek best. So, what happened was I was using many drugs that are off-label, but are FDA approved, have been proven to be safe and effective for COVID, but they're obviously very cheap. So this manifesto or declaration or whatever came out and, basically targeting me on the 5th of October, basically banning me from using a whole host of drugs that I had successfully used previously and physicians across the world have used, and drugs that are safe and effective. And I was accused of using drugs that were toxic, experimental, and had an unproven value. What they wanted me to use was remdesivir. So that was the option. So, we know that remdesivir increases the risk of death by 4%. It increases risk of complications. We know they tried to use it for Ebola and it was abandoned because it was so toxic. But what I discovered today, which was shocked me, is that hospitals get a 20% bonus on their total hospital bill if they use remdesivir. So here I am being forced to use a toxic medication which does not help patients. And the medications that I want to use for my patients, they're prohibiting me using. So, it's an outrage. It's unprecedented in modern medicine. And, I've been doing this for 35 years. All my colleagues across this country and across the world, they examine the patient, they speak with the patient and decide what's best for the patient. But suddenly now the hospital and these captured agencies are telling us how to practice. So actually I had no option, I had to quit or fight them. So I thought, what, I've got nothing to lose. I'm old, decrepit, and demented. So whatever I have to lose. So we filed this lawsuit. We went to court on Thursday. Obviously, the other side lied through their teeth right from the beginning, which was expected. And, the judge said he will decide in a few days. So I was expected to work today. So I came to work. And then I found this letter on my desk telling me that my privileges had been temporarily suspended and I'm not allowed to work. So, what? I think in the end, the truth will prevail. Good always prevails over evil. That's just the way it is. And, I've been so touched by all the support that I've received from people across the world. There were hundreds of people outside the courthouse who were protesting. It was very touching to me. And so, we're in this all together. And, whatever happens, I'm so grateful for the support. And I think these evil people need to know what they're doing is evil. Doctors need to take back medicine. That's what we're here to do. And, all I can say is thank you. Thank you, all of you.